Welcome to Ventura County's New to Medicare video series, brought to you by the Ventura County Area Agency on Aging Health Insurance Counseling and Advocacy Program. HICAPs are a part of a national network of state health insurance assistance programs. HICAP's mission is to educate the public about Medicare and counsel individuals on Medicare issues. If you worked 40+ quarters for an employer who paid into Social Security and Medicare taxes, or were self-employed and paid into Social Security or Medicare taxes, you are entitled to Medicare benefits. Medicare and Social Security full retirement age used to be aligned at age 65. Now, Medicare full retirement age is a full year before Social Security defined full retirement age of 66+. This makes it hard to remember when to initiate Medicare, so just remember 65 equals Medicare. You can enroll in Medicare at any time during your 7-month initial enrollment period, or IEP. The 7 months include the 3 months before, the month of, and the 3 months following your 65th birthday.
The date your Medicare begins, however, is determined by when you sign up. If you're receiving early retirement benefits through Social Security, then Social Security will automatically take your Medicare Part B premium out of your Social Security benefit. People with Social Security disability will receive disability benefits for 24 months and then be enrolled in Medicare. People with severe Social Security disabilities may be enrolled earlier. If you're not yet receiving Social Security, for Medicare to be effective the first of the month you turn 65, you must enroll 1, 2, or 3 months before your birthday month. In this graphic, let's pretend that your birthday month is April. If you enroll January, February, or March, Medicare will be effective the first day of April. If you delay enrolling in Medicare, even though it's within your initial enrollment period until May, June, or July, your benefits will be delayed 1 to 3 months.
Who may delay enrolling in Medicare after age 65? If you or your spouse are still working at age 65 for an employer with 20+ employees and they provide health insurance, you do not need Medicare yet. When you stop working, or if your employer stops coverage, whichever occurs first, you will have a short special enrollment period to enroll without a late enrollment penalty. Some people still working at age 65 with employer group health insurance go ahead and apply for Medicare Part A because it has 0 premium. They then ask Medicare to delay Medicare Part B because it carries a monthly premium and they do not need double insurance. Medicare is then secondary to their work insurance. It is a good idea to check with your employer benefits department to see how Medicare works with their insurance before enrolling. If you are actively contributing to a health savings account, or HSA, through your employer, you must stop contributing 6 months before Medicare Part A begins, or the money you contributed will be removed from the tax-sheltered account and becomes taxable to you.
What if you work for an employer with less than 19 employees? When that happens, you must enroll in Medicare Part B and Part A because Medicare is primary and the employer coverage is secondary insurance. If you miss your initial enrollment period or your special enrollment period after stopping work, you'll need to wait until January 1 to March 31st, Medicare's general enrollment period, to sign up for Medicare, and your Medicare won't be effective until July 1st. People who work for an employer with fewer than 20 employees, or on a retiree plan, on COBRA, an ACA plan, or private insurance must enroll in Medicare to avoid surprise medical expenses, coverage gaps, and late enrollment penalties. You don't want to find this out when the insurance refuses to pay because they're secondary to Medicare.
How to enroll in Medicare. The Social Security Administration handles Medicare enrollment. There are 3 ways to enroll in Medicare. Online by creating a mysocialsecurity.gov account and completing a short application. In person at a local Social Security office. You can make an appointment by calling 1-800-772-1213 or over the telephone at that same number. Ventura County Social Security offices are located in the following communities: Ventura, Oxnard, and Thousand Oaks. Wait times for Social Security Medicare enrollment appointments can be up to several months. We encourage that you start the process a good 5 to 6 months in advance. Remember, if you miss your initial enrollment period or your special enrollment period after you stop working, you will need to wait until January 1st through March 31st, Medicare's general enrollment period, to sign up for Medicare. In addition, you will have to wait until July 1st to start using your benefits.
How do you pay for Medicare? For Social Security beneficiaries, the Medicare Part B premium is automatically deducted from their retirement check. If you are not yet receiving Social Security, CMS will bill you for the cost of the Part B premium. There are 3 ways that you can pay for your benefit. 1, you may pay by electronic funds transfer through your bank's bill pay. 2, you can use Medicare's Easy Pay, where Medicare automatically deducts your premium from your checking or savings account. Or 3, you can pay monthly by mail with a check or credit card. If you have a high income, for example, single annual income more than $85,000 or a couple greater than $170,000, Medicare assesses an income-related monthly adjustment, or IRMA, which increases Part B and Part D premiums. You will be sent a bill for this adjustment and can pay using the same methods. If you are low income, there are programs that may pay your Part B premium if you meet the criteria. Criteria is adjusted annually, as are the Part B premium and the IRMA. Here are our summary and high-cap tips for enrolling in Medicare. Enroll in Medicare 3 months before your 65th birthday, unless you have an exception. If you think you have an exception, double and triple check with your benefits department, high-cap, and Medicare before doing nothing. Automate payments for Medicare premiums so you won't lose your Medicare if you get behind because you're ill or away from home. Meet with high-cap to learn your Medicare options. See if you qualify for any help with Medicare parts or ask your Medicare questions.
This New to Medicare video series is brought to you by the Ventura County Area Agency on Aging Health Insurance Counseling and Advocacy Program. For more information, please give us a call at 805-477-7310 or visit www.vcaa.org.